So I think we're doing a mic check here. Okay, we're good. It's just sorry it took a while for the stream to come up. Thank you so much for joining. Please like the live stream and subscribe to the channel, PDR Live. Today we're going to focus on the continuing saga of the UnitedHealthcare assassin who murdered the CEO Brian Thompson last Wednesday, and we're going to take a look at the mainstream media's narrative and what the focus has been. So I did promise yesterday that I would do a follow-up. I did take a look at a lot of the coverage since this morning, and I only found one video from a network from Minneapolis, Minnesota. It's called CARE, K-A-R-E, Channel 11. And apparently this channel has been around, this media network has been around originally since the very beginning, since 1925, but it apparently became an affiliate of NBC's television network in 1979. So it's local news, and this is the only piece that I found online that went in depth into the alleged criminal conduct of UnitedHealthcare. So I'm going to go ahead and play for you that clip right now.
Lawsuit against New details are surfacing tonight about a lawsuit against Thompson and other United Health Group executives, accusing them of insider trading. Jessica Hart has more on the lawsuit and what it could mean for the overall investigation.
For the past couple of years, United Health has been at the center of controversy. United Health Group announced 2 years ago it was acquiring Change, a healthcare technology company, which piqued the interest of the Department of Justice. The DOJ tried to stop it by suing United Health. They alleged the acquisition would violate antitrust laws, but a judge sided with United Health. Jump to February of this year, United Health is dealing with the fallout of a cyber attack against Change. Around the same time, the public learned the DOJ was once again looking into United Health, leading to lawsuits. The healthcare company, along with some of its top executives, are being sued over allegations of insider trading. One of those executives is Brian Thompson, the CEO of UnitedHealthcare. He was shot and killed in New York City Wednesday morning. Thompson and United Health's board chair Stephen Hemsley are being accused of selling some of their shares of United Health stock, knowing the company was being investigated, information investors and the public didn't have. According to the lawsuits, the plaintiffs are accusing Thompson of selling over $15 million of his personal shares between October 2023 and February 2024, when the DOJ investigation surfaced. Within that time frame, the lawsuits state Hemsley sold over $102 million of his personal shares.
The first class action lawsuit was initially filed in May with the City of Hollywood Firefighters Pension Fund. On Wednesday, a judge signed an order giving United Health, Hemsley, and Thompson until March 1st of next year to respond to the amended complaint.
Seconds to skip the video and also 5 seconds to save a life. Let me tell you how.
So that's the
countless families in Gaza
situation there with United Health, and again, this is the only
for just $5.
this is the only piece that I found online where the mainstream media focus. Well, they're not really mainstream. It's really a local network, but even though they did a decent job covering the details of the shenanigans that this company was involved in, I looked at the piece here, and basically It's only one. This piece only lasted about 1 minute and 53 seconds. That's basically it. So it's not very in depth at all. And that was really the only piece that I found that was really focused on their malpractice or their alleged criminal conduct. The insider trading, apparently, what that was about is that the CEO and I think the president of the company were got a tip or a heads up that a federal investigation about their company's business practices was upcoming, and they sold their shares of their that they have in the company, and the amount of shares that they sold was in the value in the ballpark range of $15 million. Now I don't recall from the reading that I did whether it's 15 million total with the CEO and the president of UnitedHealthcare, but that was a figure that was mentioned in the piece. So now I take you to the mainstream media reaction to, of course, you just saw what the what they're allegedly involved in. I'm going to go ahead and take you to the mainstream media's reaction to the public reaction to these nefarious practices. And here, just going to cue this.
From when UnitedHealthcare CEO Brian Thompson was gunned down in New York, and that massive manhunt is still underway for his killer in what police are calling a calculated and premeditated attack. In a new statement, the UnitedHealthcare group says this, quote, "While our hearts are broken, we have been touched by the huge outpouring of kindness and support in the hours since this horrific crime took place. But this killing has generated a very different reaction from some on the internet. Just take a look at some of these comments found under a CNN video about this story online. These are just a few, among dozens of hateful comments that we found, including one saying, quote, "Sorry, my sympathy is out of network." The New York Times writes this, quote, "The dark commentary after the death of the 50-year-old insurance executive from Maple Grove, Minnesota, highlighted the anger and frustration over the state of healthcare in America, where those with private insurance often find themselves in Kafkaesque tangles while seeking reimbursement for medical treatment and are often denied." And that frustration is something that doctors say they've seen from patients throughout their careers.
I see people when they're at their lowest, when the system has failed them, and I'm frankly not surprised. They feel abandoned, they feel exploited, they feel lied to when it comes to the healthcare system, and especially insurances, because of the things you mentioned: denials, prior authorization, narrow networks, the cost of healthcare. It's been going on and bottling up for a long time.
So our panel's back. Annie Linsky, we're going to be clear here about the tragedy that is Mr. Thompson and his family, right? And set that aside. But what we do see in the wake of this is an outpouring of anger around the way people have been treated by these companies. Now, we're again going to be clear. We are not saying that this justifies any sort of violence at all. But this conversation has really exploded. I mean, my family's talking about it.
Absolutely, mine is too. I mean, of course, vigilante justice is not the answer to the problem. But what I should say is, and this incident and the reaction to it ought to be a wake-up call to this industry, which has, there have been many big, really good investigative pieces about UnitedHealthcare in particular, and the issues that their customers have in getting the health care that's promised, getting the responses promised. And if it's not it's not a wake-up call to the industry, it certainly will be to Congress, and they are going to have there will be laws.
In a CNN story that was.
So, and again, it's like the wolf protecting the chicken coop, or the saying. So the healthcare industry, this woman basically said that she thinks that this is a wake-up call for the healthcare industry. which is ridiculous. As if the healthcare industry is going to self-regulate. That's not going to happen. The only way that that would happen is if Congress regulates the healthcare industry. The problem, again, is the theme that we keep overall in this social media group that we have here. We keep raising is that the influence of big money is the problem, is the root of most of the problems within our political system. So if these companies continue contributing to super PACs, to political candidates, campaigns, you are not going to see the healthcare industry self-regulate, and you're not going to see Congress really take significant action to regulate the healthcare industry. And what some people like we are calling for actually is not really regulation, it's more of an elimination of the private health insurance industry, because the only role of the private health insurance industry is to make profit. That's it. That's their number one priority. They're going to prioritize that over the human lives, period. And so what we need to do is elect people who are not beholden to these industries, who are not going to take money from them. That's the issue. So the woman here who spoke there is just being very disingenuous to the public. And this is a very disingenuous take because, again, number one, they're not going to self-regulate. And then number two, she correctly brought up the fact that, yes, Congress should take action if they don't, which the health insurance industry is not going to do that. Why should they? The guy who was murdered, the CEO, was making $10.2 million a year. Okay, the shares that he had owned millions of dollars of shares in his company. So why would anybody within that system give up all of that wealth? It's not in their interest to do that. I mean, this woman is completely just, it's what she's saying is just complete trash. I mean, and this is what's going out. But thankfully, the public is really not buying into their BS. And we'll actually take a look at their comments here. I took a look at some of the comments of Ben Shapiro did a reaction piece about this. And if you read the comments, almost 100% of the comments were against him because he was basically arguing that this was a left-wing thing, and look how the left-wingers, how terrible they're sanctioning violence. When you look at the comments, both left and right were saying this is not a left issue. This is clearly an issue where the American public is just sick and tired of the health insurance industry, because almost everyone has a negative or tragic story involving them being the middleman between themselves and their doctor or their hospital or their clinic and so forth. So we're going to go ahead and continue this CNN panel's nonsense reaction to the UHC.
Was just published about this. They note that a Facebook post that was put up by UnitedHealthcare expressing sadness about the CEO's death, it received 62,000 reactions. 57,000 of them were laughing emojis.
I mean, that's sad to think about, but look at this. I mean, and you're right. Most of these healthcare issues are life or death. And I have a sick dad home in Louisiana, and we go to the doctor all the time, and sometimes we get denied for things. And it doesn't feel good, you know? And so I think people have a personal issue with the way their healthcare has been administered. And I think, to your point, Annie, over the next few weeks, few months, we're going to have a conversation about this. If Congress has to take action, I think they will have to, but we hope that these private companies can come to the table and be a little bit more consistent in the way.
Okay, so he says it doesn't feel good if you get rejected. I mean, that... Oh my God. Okay. You know, and they're taking this personally. They're just minimizing the experience of the public. It's like, it doesn't feel good. It's like, oh, I was just let down. You know, they just rejected my request. Oh my God, it doesn't feel good. It's beyond that. That's just ridiculous. People are aggravated. They're angry. Yeah, when I had Kaiser years ago, I remember I went there. I think I went there for a TB test for my employment because they were requesting it. And in the lobby, there was a parent there who was just really upset. He just looked very agitated. He looked like a gentleman in his 30s or 40s, and apparently he was there with his child. And he just seemed very angry, agitated, and was irritated because apparently I think it was his son. I don't think it was a daughter, if I recall. I think he was with his son, and his son looked like 10, 12 years old. And so, because apparently they were giving him the runaround, and he was very visibly angry and upset. And I was just walking by there, and I noticed that for like 10 seconds when I walked by there, before I headed to before I waited for the elevators to open to exit the building. But yeah, I mean, let down. I mean, people are aggravated about this system because literally it's life and death, so it's not that it doesn't feel good that you get rejected. It's aggravating, and so people are angry at these companies who conduct their business in this manner, and being let down is not the problem here.
They administer healthcare, I think that would be helpful. UnitedHealthcare has already been the focal point of ire for Congress.
Yes, because it's vertically integrated. They're buying up doctors' offices. They own the largest PBM, which controls the price of prescription drugs in the country. Yep. They're the most aggressive on denying claims. I think UnitedHealthcare will get more scrutiny.
Yeah, and of course we don't know the motivation yet of this killer. We just know that these two words were found on these bullet casings. But Elliot, this is something. The fewer means you have, the harder it is to fight back against some of this stuff. And it is something that happens, it seems like this is a universal experience for people.
Yeah, and I agree with everything that's been said here. This is exposing a frustration in the public across income levels. I just think, just to state the obvious to some extent, Casey, this is as much about the internet and how the internet has broken us as a people. Most of the people putting those laughing emojis and responses would never look this person's wife in the eye and make those things, no matter what kind of problems they might have with how United handled their health care. And that's really, to me, what this is all about.
It's coarse. Very coarse.
Very coarse.
The killing of CEO Brian Thompson.
So I highly doubt that. The gentleman just said that, these people who are making these comments would never dare look into the eyes of the families of this dead CEO. They would never dare to do that. And I beg to differ. I think they would, because the problem with these health insurers is that you can't get a hold of them. You call them. Just getting someone on the phone, you're put on hold a lot. And so the experience of, that happens with Medicare and Social Security a lot. You do get put on hold. That's, there is, government bureaucracy is a problem as well. But with the healthcare insurance industry, with the government, they're dealing with the whole entire country. With the healthcare insurance industry, they're just dealing with their clients. And it's aggravating. You're put on hold, and then you have to make the companies that are doing these prior authorization requests, you put in the request, and then it's just taking so long for you or your loved one to get, their treatment or whatever, their operation accepted, or you might get a rejection letter. We haven't gotten a rejection letter at all. And again, like I explained before yesterday, my dad has Medicare, so the government is really footing the bill on that. He's 77 years old. But people who don't have Medicare yet, and they have to pay into the system, they're probably going to get rejected. And in the case of UHC, they were rejecting 1 out of every 3 claims that were being made, and they used an AI to reject those claims. And the AI, apparently, from what I was reading, was inappropriately rejecting claims. So they were rejecting claims that they should not have been rejecting. And then that's something that CNN panel, these clowns, the clown news network, they're not pointing out. That type of conduct should be looked into, and it should stop. And we're not condoning what the person did, but yet, this is what it took to talk about this stuff. Okay, so, and Bernie Sanders did try to raise this issue in 2016, 2020, and what did CNN do? They tried to sideline him, right? They attacked him because of his advocacy for Medicare for all. So we've tried to talk about this issue, but you guys keep, running interference for the healthcare insurance industry that you guys protect so much. So this is just a bunch of nonsense. It's just ridiculous. And again, they're trying to minimize they're not even pointing out the video that I mentioned, that I just played earlier, 1 minute and 53 seconds. They mentioned all of the alleged illegal practices that they're involved in. Insider trading. God, so they're selling shares when they got it tipped off that they're probably going to be under a federal investigation, and they made millions from those transactions. Okay, so they're not even pointing that out at all. So it's very very disingenuous.
Problems they might have with how United handled their health care. And that's
very,
really,
very,
to
very
me,
good
what this is
point.
all about.
It's coarse.
Yeah.
Very coarse.
The killing of CEO Brian Thompson has struck a nerve in this country. I mean, have you seen some of the stuff people have been saying online? It's exposed just how angry folks are at America's healthcare system. Just a sampling of the comments. My thoughts and prayers are out of network. Another, as they told me when they were denying to cover my medication, sorry for any inconvenience this has caused. And then there's this one. I can't seem to find the room to care over my daughter's $60,000 cancer treatment. Thoughts and prayers. Now, it should come as no surprise that people are mad at healthcare companies, very mad, and UnitedHealthcare included. There are many horror stories of denied claims that have led to suffering for patients and their families. But there are some people, as we speak today, who are now openly celebrating the CEO's murder and even advocating for more death. One person writing, America needs to gun down about 50 more CEOs in cold blood before we can say we are actually progressing as a country.
We here at Media Buyer Academy train everyday people, no different than you and I, to run.
Okay, so you see there the shock, all right, and the oh my God, how could these people think like that, or how could they say such a thing? Well, I mean, I think we've already explained why. I think that they in the reporting, and even they know why people are reacting in this manner. So the person here wrote, I'm reading here, America needs to gun down about 50 more CEOs in cold blood before we can say we are actually progressing as a country. So I think they're making a point, right, that this country really doesn't take action until there's some type of crisis, and even then, right, you look at the Parkland shooting, the country didn't really they took local action, but national, there was practically very little done to address the gun control issue. So we have people who are armed and dangerous walking our streets in many of our states, not all the states, but many states in the United States. So look at 9/11, right? The government was tipped off that something was about to go down a month before, and Bush didn't do anything, right? And they were specifically tipped off about the World Trade Center top. So this country, I mean, it has a history of just not taking action, not doing the right thing, and just waiting for a crisis to happen. So I think that's what this person was pointing out. And this CNN reporter, this anchor, there's just, oh my God, there's shock. How could you say such a thing? You know, so uncivilized. It's just a bunch of nonsense. And so we'll play some more here.
As a country. Is this
Really where we are with gun violence in this country? And in this instance specifically? Look, you can be mad at the system, all of its flaws, and the people who run it. That, I understand. But advocating for murder as a way to solve the problem or seek revenge as a means of, what was the word? Progress? It's just wrong. Full stop. Stop. Joining me now, emergency medicine physician, Dr.
You heard her? I hope you're listening. Stop. How dare you? Don't talk like that. Stop. You should be ashamed of yourself for writing those comments like that. Bad, 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 bad. Stop. You tell them, sister. These people are just insane. It's so.
Amy Faith Ho. Dr. Ho, thank you for joining. Are you surprised at all by just how dark some of the commentary has been around Thompson's death and, frankly, the healthcare industry more broadly?
You know, I wish I was more surprised. I'm with you. I do not think we should condone this. This is a tragedy. Someone has lost his life. But I'm an emergency physician, so I see people when they're at their lowest, when the system has failed them. And I'm frankly not surprised. They feel abandoned. They feel exploited. They feel lied to when it comes to the healthcare system, and especially insurances, because of the things you mentioned: denials, prior authorization, narrow networks, the cost of healthcare. It's been going on and bottling up for a long time.
We do bring people at their most vulnerable points down to their knees, and then money becomes a part of the healthcare process. We have talked about this for years, and you well know about this, but this just shows you, the celebration of a murder, openly advocating for more of it, and at that level, not of a healthcare provider, but the insurance industry, that takes it to a whole new level.
I think it's that people just feel so lied to. Healthcare is for the healthy and the wealthy, is the saying, and healthcare insurance was supposed to help make it more affordable and accessible. And so people paid their premiums. And when they needed healthcare to be there for them, they found that insurers were taking every tactic to not pay, because ultimately the insurance's fiduciary responsibility was to their shareholders and not to the patients. And that's the exploitation that I think patients feel. And then they're already in a situation where they're sick and they need care. And so you add that to the vulnerability, and frankly, they are just sick and tired, literally, of dealing with the system.
We don't know the motive behind this attack. We do know that there were certain words found on the bullet casings that reference common terms in healthcare grievances or the healthcare industry. But even if this motive is never identified in this way, do you think that this tragic incident is going to reshape the way the healthcare industry is responding to the anger?
I hope it does. I think the anger has been going on a very, very, very long time. I think UnitedHealthcare is certainly one of the largest insurance companies, and frankly, one of the ones that's known for its denial rates and prior authorization and some of the other coverage comments that you've had. I hope it does show how badly we need a rehaul in healthcare. I do not think it should happen from the murder of individuals, but I think it really puts the onus on us and on congressmen to look at what is healthcare reform in America.
That's going to be the question for so many. We think of it this big umbrella term of healthcare, but the nuance, the devil in the details, how it impacts individual people, it's got to be a part of the conversation when there is this level of anger and response, and we are still wondering what the motive in this tragedy really is. Dr. Amy Faith Ho, thank you for your work in helping to bring attention to suffering every
So
hour
notice
of
that
the day.
the
based on
devil's
their
in
own
the
healthcare needs as
details.
well. Thank you.
They're not really serious about so this person is really not serious about really doing anything about that, in my opinion, because the devil's in the details. So to me, that just means that it's going to be hard to get anything done. So these are the comments here from that video. Where's the reporting on the people who die due to not being covered by insurance? Writes the Fox of Laurel's 3437. This was a day ago. The CEO who was killed got a 90% raise last year. His salary was 18 plus million per year. So I had read that his salary was 10.2 million a year. So that's actually news to me. Did you get a 90% raise last year? Can you justify that where you work? Of course not. It's wrong. Stop. Says the rich lady whose paycheck depends on being the mouthpiece for the richest people in this country. We don't feel lied to, exploited, abandoned. They've actually been lied to, exploited, and abandoned by the healthcare system. So and here's just some more comments here. Turns out the country is united on something, writes Phoenix J81. Hateful comments. This dude made money off of millions of people suffering. Get out of here with that BS, writes Blue 3260. I worked for UHC, but I resigned in September. I saw that they were doing. They were denying autos, so that's the authorization that they were talking about, before a patient's procedure without even informing the patient, thereby causing unnecessary chaos. It was hard for me to continue listening to grown people cry over the phone about their sicknesses and the lack of collaboration from UHC. I have no regrets about leaving that company. And then all the supervisors cared about were their metrics and bonuses they get from meeting the numbers. I'm glad I left that company. No regrets. My dude, you have this backwards. The UnitedHealthcare CEO would never look a son in the eye and be able to articulate why his mom had to die after paying her premiums for decades. And just the comments go on here. Empathy is reserved for those with empathy. Another comment here. You never report the people who died due to not being covered. And that's key right there. I mean, that's what I've been saying. That they're not focused. They're just focused on the CEO and his family. But where's the focus on the other people who've been negatively impacted by this company? How many thousands of people did he kill? I despise CNN for using words like frustrations to describe what Americans have dealt with. I'm, quote, frustrated when I spill my coffee or when my dead car battery makes me late for work. When a loved one is denied coverage for a life-saving treatment and I have to deal with potential bankruptcy for pursuing that treatment, frustrated doesn't even begin to describe the level of burning, violent hatred I have for the system. And then that's key right there. And we talked about the elections, and people have correctly pointed out one of the reasons why Trump won. It's that he was able to tap into that frustration right there. Just like Bernie Sanders was able to tap in to that frustration in his campaigns in 2016 and 2020. And the Democratic Party is really, they're not interested in tapping into this frustration. They're putting up candidates who are out of touch with this public sentiment on this issue. And somehow, given the millions who have felt this way for decades, this high and mighty panel still finds a way to trivialize what Americans have suffered through. CNN and their ilk have demonstrated yet again that they will do everything in their power to humanize the predators of our society who sponsors their network. I'm not a Trump supporter, but his populist message against the legacy media's deep-seated corruption and moral rot is spot on. Okay, and then that's just the problem. This person here, Jared Greenhouse 6603, he said it. He articulated it very well, very succinctly, and to the point. Good job there. I'll give him a thumbs up. Those who make peaceful revolution impossible, that's a JFK quote, by the way, will make violent revolution inevitable. That might be an urban legend, though. I'll look that up, though. But apparently that is a quote attributed to JFK. Annie Linsky, vigilante justice is not the... Oh, so again, that quote right there, it's just, he's referencing a liberal Democratic president who, this quote is attributed to him. Right? He even says that if you make peaceful revolution impossible, you're going to make violent revolution inevitable. It's bound to happen. Annie Linsky, vigilante justice is not the answer to the problem. Anthem Blue Cross, we're reversing a policy to limit anesthesia coverage. Exactly. I mean, it's just very clear. It's clear cut right there. The next one, it's so frustrating to hear these news people saying, I don't understand why people are responding this way. Clearly, you've never been denied life-saving medical treatment on the whim of someone who makes millions and millions of dollars for those denials. We've been outraged for years. You're just now seeing what we all are thinking, which is, this man has killed thousands of, if not millions of innocent sick people. We have no sympathy for him, and we never will. The Mac Jew writes, yeah, no, everyone who has a problem with the public's reaction is someone who has access to health care and hasn't ever had to worry. The only people that can't understand its reaction are rich people. If this guy gets caught, the people should rally for a pardon. Quote, my empathy is out of network. That's a good one. CNN, give equal time to health insurance exposés as you are giving to the story about one corrupt man's death. And that's the point of this live stream here. That's what we're saying here. That where is the focus on their business practices? I only found one video today from an NBC affiliate, and it wasn't even 2 minutes long, right? With the time constraint that they put on those reporters to put out that story, I felt that they did a very good job. 1 minute and 53 seconds to try to put as much information in there to inform the public about what this company is doing. But there should be more of that reporting, and it should be more in depth. They should go into it 30 minutes. Some of these videos from CNN are 30 minutes long. So they should do a 30-minute long expose on United Health. And then they should do more exposés on the other companies who are doing the same thing. Sometimes we get denied for things and it doesn't feel good. That's exactly what I was saying. So that's the quote from that guy on that panel. These people and all elites are so out of touch with what the average American deals with. This is not something that doesn't feel good. This is a matter of literal life and death. Can't pay $100,000 in medical bills, but you can pay CEOs $10 million. So that's the amount that I believe Brian Thompson was making a year. 10.2 million is what I read. So I know somebody else commented that they said that it was more than 18 million. We don't need insurance. We need real health care. Exactly. I didn't see anything. My eye exam was denied. Okay. Best one I've seen is from a Brit. Quote, America really did find a way to improve healthcare with its lax gun laws. Well, but that's not true yet. We don't know that yet. Because unfortunately, this story is gonna, you just give it time and it'll die down once the media focuses on another issue. Then the narrative changes, right? The public outrage remains, but the focus from the media shifts. So that's the problem. How do we change that? How do we keep the mainstream media focused on this. Does it really have to take people getting gunned down for the media to stick to this topic? Because I know they talked about this topic in the 2016 campaign and the 2020 campaign. It was discussed when Medicare for All was brought up as an issue by candidates like Sanders. And then in 2020, you had more politicians who co-sponsored that Medicare for All bill that he was championing. And some of the Democratic candidates who were running in the primaries said that they supported it, like Elizabeth Warren and Kamala Harris, and then she later backtracked. And then some other candidates like Pete Buttigieg came up with their own different plan. And Joe Biden said that he was not for Medicare for All, but was for a public option, but never did anything to pass a public option at all. So that's been a problem in this country, that we've talked about this, it's been discussed, but it keeps getting forgotten. So how can we change that? Will it take rallies in front of the CNN building in order for that to change? So who knows? Who are CNN and lecture people how to react? Your job is to report the news. I think he doesn't realize how bad this is. Most people would tell his wife straight to her face, just because you are a coward doesn't mean we all are. People used to put dudes like this on display in a town square after they got murdered. Stop blaming the internet. This is the most that Americans have agreed on something in the past decade. I'm surprised this doesn't happen more often in a country with for-profit healthcare. It's not, quote, some and dozens, it's most and thousands. I'm really loving all the people living in their ivory towers trying to lecture us on morality. Okay? Is this really where we are with gun violence in this country? I mean, gun violence hasn't stopped when children are shot in schools, so they keep saying some people or some comments like this story hasn't produced the greatest online unanimity since the advent of social media. Brian made $10 million annually to deny people basic health care and dignity to life. I don't see much sympathy coming his way. Deaf panels? This dude was the chairman of one. The unfortunate, and then that's a reference to Republicans who argue that if we turn healthcare over to the public sector, to the government, that we would be instituting deaf panels. The unfortunate truth is the typical American pays 30% more for health insurance than our European counterparts, and we have worse outcomes. The gluttony at the top has to stop. And again, that's the incentive that the system provides. So that's why these people keep doing this. Some on the internet, it's everywhere. So just look at all these comments. I mean, how many comments are there here in this video? 3,725 comments, right? They got 2.9 thumbs up. How many? 135,000 views, which really I've seen other videos with more views. But you just look at these comments here, and there's no one really expressing any regret, remorse over the death of the CEO, because they're just, can we blame these people for expressing their anger, their frustration at the health insurance industry? I would say not, because it's their lives. It's their families' lives. So how could you look them in the face and tell them that they shouldn't react that way, that they should be more civilized? Where was this civilization or this civilized attitude? Where was it when they were asking for help from the health insurance company? So this healthcare insurance industry was not being civilized at all with them. And you just look at these comments here, and it's just almost unanimous. Just the outrage. And again, this is an indication. This is just one video, but you look at the anger here, and what a politician can easily tap into this frustration. And we now know why the Sanders campaign did so well in 2016, came out of nowhere and really posed a challenge to a candidate, Hillary Clinton, who was already going to be crowned the Democratic nominee because she had already marshaled all her support the previous 2 years. So it was already factored in that she was going to be the nominee, and Sanders was a last-minute addition to the primary there. He wanted a progressive candidate to challenge the establishment candidate, and Elizabeth Warren was not willing to do that. He wanted Elizabeth Warren to run against Hillary. She refused, so instead, in lieu of Warren, Sanders decided to run. And when he ran, the campaign took off. And really, the one slogan I remember that he effectively used, the Field to Burn hashtag, was not his creation. It was, I believe, somebody from California Nurses, that union, California Nurses. But the one phrase that he used effectively early on was "enough is enough," and that just clearly describe people's feeling that this is enough. You know, that we're sick and tired. And he kept saying this: so we're sick and tired of the health insurance industry, and and the things that they're doing. And I think that's why a lot of people didn't, and myself included, I didn't think that he would do as well as he did, because he was known as the only socialist representative in Congress for a long time when he was a member of Congress, a member of the House. And when he was first elected as mayor, he was known as one of probably the only openly socialist mayors in the country. So I didn't think, because of his ideology, that he would do so well. But apparently, he had just tapped into a nerve in the American public, and the reaction to what he was saying proved to be helpful to his campaign, and he almost won on both occasions, and he just posed a threat to the establishment. But I mean, I think you look at all these comments, and it's a shame that we can't have a candidate. It doesn't matter the ideology, right? But we can't have a candidate who can organize these people, right? And win the White House. And then use this organization, all this anger from these people, get them organized, and to push the Congress to end this system, this horrific system that the people are. I mean, why can't we do that? It's a shame. It's a shame that we can't at the moment. But let me know what you think of the opinions I expressed, and the mainstream media's coverage. Please like the live stream and subscribe to our channel if you have not done so. Again, this is a PDR live stream, and thank you guys for